flu came to Britain like COVID-19, there was no cure. Like COVID-19, it was transmitted by airborne droplets. Preventative measures were not taken, and the scale of the deaths was played down. At the height of the epidemic, 358 people in Leicester died in 1 week. Local authorities were left to manage as best they could. Like COVID-19, there was no cure. Like COVID-19, it was transmitted by airborne droplets, and people died as the flu developed into pneumonia and bronchitis. And like COVID-19, it is likely it crossed over from the animal kingdom, and both birds and pigs have been suggested as a source. The medical establishment had failed to comprehend the severity of the disease. Spanish influenza is the latest threat held over our heads by scaremongers. It is merely a coincidence of influenzic colds and the gastric troubles that have arisen from an unfamiliar diet. There was no evidence to show that it was virulent. Dorset Street, where 19-year-old spinner lived. Unlike COVID-19, the virus affected young people disproportionately, and by July, a very large number of children in Leicester were ill. It was estimated that 7,000 out of 57,000 children in Leicester were affected. Arthur Newshome was the chief medical officer. His inaction cost thousands of lives. Plans were shelved. They were shelved because they were interfered with the war effort. The first victims of the second wave of influenza was none other than the Prime Minister, David Lloyd George. His illness was hushed up and his confinement was described as a precautionary measure. This second wave of flu was more virulent and deadly. It had spread like wildfire. There were just 5 deaths in the first week of October. The following week, there were 54. The week after that, the death toll was over 200, and the epidemic reached its peak in the last week of October when 302 people died from flu-related illnesses. People were found dead in their homes.